All right, good afternoon, everyone. We are in the home stretch now. I'm Beth Nitch. I work at KFMC. I'm our external quality review senior manager. Really grateful for everybody attending today. We're so glad you made it, and we need your partnership, continued partnership to do this event in the future. So thank you, and please keep coming back and get involved. So this afternoon, we're fortunate to have two of Kansas's community health worker leaders speak with us. Treva Smith is the Workforce Development Specialist for the Community Care Network of Kansas. She has nearly 2 decades of experience in community health and has served in many roles in the community health worker landscape across the state. She currently serves on the Kansas Community Health Worker Coalition's Education Committee and was elected to the board of directors for the National Association of Community Health Workers in 2022, among many other things. That's the condensed version. Similarly, condensed version, Angela Scott has been part of the growing community health worker infrastructure in Kansas for many years. She has over 8 years of experience in supervising community health workers and is currently the community health worker field supervisor at the University of Kansas Medical Center. She's been dedicated to community health worker advocacy and education, working to equip community health workers and organizations to stand up community health worker programs. Angela currently serves as the co-president of the Kansas Community Health Coalition. So in previous roles of mine at the state of Kansas and with KFMC, I was lucky to help build up the Kansas Community Health Worker Coalition, and I was able to meet both of these wonderful ladies. I was sad to step away, but I feel so good knowing that these initiatives and just effort are in great hands. So please join me, ladies.
Good afternoon. I'm Angela Scott. I'm the co-president of the Kansas Community Health Worker Coalition.
And I'm Treva Smith. I am a community health worker instructor and also a member of the Kansas CHW Coalition.
All right, we are excited just to be with you this afternoon just to talk about the landscape of the workforce for community health workers across the state of Kansas. So a little bit about what we'll be talking about this afternoon. We'll be describing the current landscape of community health workers. We'll talk about innovative trainings and work models in Kansas. And we'll be also analyzing and emerging state and national policies that impact the work that we do. So locally, statewide, and then also national impacts that we have seen. We'll also be talking about strategies in sustainability and integration of the workforce, community health workers, and then how we can continue to duplicate these programs. Okay, so as the co-president of the Community Health Worker Coalition, this information that we're sharing with you currently, and these numbers have actually changed since we put this presentation together. Currently, we have 375 certified community health workers in Kansas, and I don't know if everyone in the room is familiar with that, but Kansas does recognize community health workers as a profession. And so there is opportunity to receive certification and recognition for the work that we do. And then also, and that information is based on the Kansas Coalition data that we have. We also know that we have about, in all of our counties in Kansas, we have had at least one community health worker, so that speaks to the importance of the work that we do every day. Community health workers, we focus on various different populations, whether that's somebody who has chronic disease management, if we're talking about folks who are unhoused. We also can focus on mental health, maternal health, and other under-resourced populations in Kansas. And so recently, and actually it's probably been over a year, but Kansas has also recognized community health workers, and we do have the billing mechanism for Medicaid in Kansas. There was a lot of work that still needs to be done in regards to looking at funding resources for community health workers, but we are excited again about just the recognition that we have in Kansas and the important role of community health workers in urban settings, frontier settings, and then also in our rural communities. Okay. Just so some strengths, more strengths that we have in Kansas. We do have, as I mentioned, the Kansas Community Health Worker Coalition. On the coalition, we have committees, we have subcommittees that focus on sustainability and advocacy, education for community health workers. We also host a community health worker in partnership. We were hosting with WSU Community Engagement Institute. We have a symposium that we have each year in Wichita, Kansas, where we have community health workers come together across the state and receive training. We have the ability to network with one another, and then again also talk about workforce development and those things that are important to us. We also have training models for community health workers for the core competency training, where our community health workers, they can get 100 hours of classroom training and then also 60 hours of service learning, and they can receive through that training, they are able to apply for that certification that we talked about. There are also other pathways to receiving certification in the state of Kansas, but we definitely encourage all community health workers to go through the core competency training. That training is forever developing, I will say. We want to make sure that we have the most efficient way of training our community health workers, because what happens a lot of the times, community health workers get hired and it's time for them to go to work. Sometimes they don't have time to go through the full, because right now it's almost a 3-month training, but we're also talking about avenues and ways that we can effectively provide this curriculum to community health workers across Kansas, and then also taking a look at other training models that would be helpful and useful for community health workers to be prepared to take on the job from day one and begin to serving clients. Okay. Also, just as far as in Kansas, we have community health workers that work in various settings, whether that's clinics or hospitals, or if they're working with community-based organizations. We have community health workers that are working with Department of Corrections, and some of our counties are working with police departments. We also have community health workers who also work with mental health organizations, EMS, you pretty much name it. There is going to be a space that a community health worker can be useful. And so one of the things that as a coalition we are dedicated to is providing education in the community about how community health workers can be utilized in various settings in new ways that maybe an organization hasn't thought about before, including, for example, community health workers can be found in a beef packing plant in western Kansas. We were able to do a pilot there, and we saw the benefits. The employer saw the benefit of having a community health worker just available to be able to pass out education information to their employees as they were changing shifts. So again, community health workers can be very useful in various different settings. Okay.
All right. So just talking about some of the innovative spaces, and Angela kind of shared one of the most innovative spaces with the meat packing plant, but there are others as well. We talked about just as involved folks. I personally currently am teaching a course in the Topeka Correctional Facility. I'm training residents who are there to be community health workers in the spaces where they are, as well as we're working on a work release type program so that they can work outside of the facility as well. And so that has been wildly successful. We're on our third cohort right now. We're still developing the actual work for these residents, but very well received from the warden and all of those involved. And we've also seen some duplications already across the nation. So that's been a really fruitful one. CHWs have been embedded in prenatal and postnatal care for a very long time. But we're now starting to partner a lot more with doulas who are also able to bill and receive funding. And so we're training now what we call community doulas. So they are trained CHWs as well as in the doula space. So that one's been great. The Healthy Start model has used CHWs for now a decade or so. And so that's been a really good space for CHWs. The community doulas, I guess I jumped the gun on that one. Also dental. So I personally worked in the dental space as doing CHW work. I coordinated all of our outreaches for the FQ that I was working with in Missouri. We were able to go out to different shelters and different schools, just to provide dental services. And then the CHW is there not only to coordinate those events, but also to follow up with education and provide resources when they were needed. So that's another space. And also give some education, like I said, just health education to follow up. Mental health and SUD, that's another space that I've been working in for, I don't know, about 6 or 7 years. I've been working with a work group with SAMHSA in regions 5, 6, and 7. And we've been working at what it looks like the peer CHW alignment of that community work, right? So if any of you have ever worked with or worked as a peer, you understand that you don't just work on SUD. There are other barriers, and I think each speaker has talked about that. You know, we go to work with people for this, but we find out there's A, B, C, and D that we also need to work on. And so that's why CHWs pair so well in so many different areas, because CHWs can meet those social needs that folks may or may not be trained in depending on the area. Interpreters, that's another space. It's a nuance, and it's an area where we have to tread very carefully, right? But CHWs often are slated to translate in, be it medical areas or just areas in particular. Medical is where we really need to be careful, right, to make sure that they are medically trained to interpret information. But again, you have that trusted person that's already working, and they can not only translate the actual language, but they can translate those meanings, right? So I speak English, a little Ebonics, but not a technical language. But I do understand that I may have to say hypertension different to my older population who is like, what is high blood pressure? Diabetes, you might have the sugar, right? So those are also little technical translations, right, that we have to sometimes interpret. And then there's chronic disease management, which is really one of the ones that I am most excited about. Did that go away too? It did. Okay. Okay. I will do my best. So chronic disease management is a really huge space that CHWs, honestly, from my perspective, are underutilized in, but can really move the needle in those spaces. Being that cheerleader, being that coach, the kind of just accountability partner, right, to help in those spaces, especially when we're talking about new diagnoses. It really is helpful when you have someone who's from where you're from, who speaks your language, both technically and actually, to kind of help you through this space. And did I change I did. Let's see. Make sure I got them all. And then research projects. Research is another space where we have seen CHWs do some really good work. Again, it's a space, just that trusted person can often get that information a little bit better than obviously your doctors, your other, what I affectionately call data monsters, who have those numbers in their head. They know what they want and they're great at that, but the interpersonal skills may not so much. So our next slide here, we'll talk a little bit about the state and the national policies and impacts of CHW sustainability. So what we have now is we do have here in Kansas, not every state has Medicaid reimbursement, but we do. And so that is a big plus. I think it's only like 17 states nationwide who have that. And so we've been working on that since Beth was with us. So at least 10 years. And so we're very excited to have that. I think it was July 24 when that was done. And so we're still working out some kinks and some bugs. But FQs can now bill for those services. And then Medicaid, so CHW work can be billed through Medicare. I get them mixed up. I don't know why they couldn't come up with something else. Anyway, but Medicare under the CHI. So if anybody's looking for that services, the CHI services, and that's also a space where that's a federal funding, and it's a little different, and it includes other things besides CHW work, but CHWs can bill through that mechanism. There are private insurances now who are hiring CHWs to work. We know our MCOs hire CHWs themselves to work, and then also providing some reimbursement funds for that. And I don't remember what the next topic was under private. Private insurance. Do you have any other sustainable? We talked about private companies, finding the value of CHWs in big business, especially places like those meatpacking plants or that hire immigrants or folks who come in doing seasonal type work. Those places are often different areas. And then we talked about certification, which is also a pretty big deal. We've had certification. What year did we start? Was it 2022, 23? So certification allows for a somewhat standardized training mechanism, which is what our billers and people are looking for. And so here in the state of Kansas, CHWs must be certified in order to be able to bill. So that's another piece, if you didn't know, put that in your pocket. And so to get that certification, we have that training. We offer core competency trainings, which is the 100 hours in the 100 classroom, 60 service learning. But then we also offer continuing education courses. A lot of times we get those from our symposiums, spaces like this. Our CHWs can use for continuing ed, and then some specialized trainings. KDHE offers some work groups, some specialized trainings around diabetes, heart disease, maternal child health, those types of things. And then any others that we can come up with that we feel like would enhance a particular job skill, we're open to that as well. And I think this is you.
All right. One other space I wanted to mention that community health workers, where we're seeing specialized training, is in mental health and substance use disorder. That is something that usually community health workers get the basic training of mental health first aid. But we find that, of course, we need deeper training in that. And so there are some pilots going around to be able to provide mental health and substance use disorder training for community health workers in conjunction with their other CEUs that they can receive. So in this work, we know it's not without challenges and gaps. So some of the things that we experience as community health workers are workload, burnout, role clarity. So the true job expectations and scope of responsibilities for community health workers. I feel like we've seen, especially after COVID, there seemed to be an influx. Of course, we had funding, but we also see an influx of different industries or different entities applying for funding and hiring community health workers, but they really were unclear of what their role should be within their organization. And so we saw some challenges there that maybe community health workers were being utilized for the receptionist, or community health workers were being utilized strictly for an interpreter, and really missing the true focus of what a community health worker truly is in their scope of work. Also, language and cultural services, while with Spanish curriculum, they're currently developing, and we were able to offer some programs where the Spanish-speaking community health workers and promotores de salud were able to receive training in their language, so Spanish offerings for the core curriculum. And through that, they were able to get certification as well. Also, sustainability is no secret. That is a huge challenge. In March, I think it was, we took a big hit of losing funding that supported a lot of community health workers. And that work stopped immediately. And so we saw a lot of job loss. I previously worked with a program through KU where we hired over 60 plus community health workers across the state of Kansas. And again, the majority of them, due to lost funding, those organizations were no longer able to sustain those community health workers. So we know due to termination of grants, that is a challenge that we continue to face. And so another reason why we have to look at other funding sources for the workforce of community health workers, not focusing on just on federal support or state support, but also looking at maybe corporate partnerships and other ways to sustain our workforce. Okay, and again, just because we were experiencing those impacts of loss of funding, we saw the workforce decline. Also, community health workers deciding just to leave the field altogether, and maybe it's better that I be a social worker or going to another field, just so that they could have that sustainability. Also, even though we now have the ability for some organizations to bill Medicaid, even the reimbursement for Medicaid still can be challenging for some organizations, including the process and how to navigate getting that reimbursement. So we do know those challenges exist. And specifically for the Kansas CHW Coalition, we also experienced some challenges. I took over my role. It's been 10 months now that I've been in the role. And it seemed like right when we were getting our feet into the water to take over from the existing, the previous board, we had to make a serious shift because our funding was also impacted as well. And again, if you're not familiar with the Community Health Worker Coalition, we are the support for community health workers across Kansas. And we are just grateful again for the work that was done many years ago to establish this coalition. And so the work of the coalition was also put at risk. But I am excited, even though we're talking about challenges and gaps that we see, I am hopeful because of partners that we have, whether it's the MCOs who are supporting us, our community-based organizations, our allies that are in the room over here. Callie, she is a faithful board member, and those organizations who know the importance of community health workers and want to continue to support us. Grateful for Health Fund and David Jordan and his group, again, who know the importance of community health workers and wanted to support us through these challenges. And so, again, I am hopeful that even though we saw the loss in the workforce, that we will regain it again and come back even stronger and be able to provide support to our community health workers through education, through providing professional development and even personal development of our community health workers. The other thing I see as a hopeful thing, and I'm probably going into yours of what we see the future, but I'm on my hopeful kick here, is the increase in, as I said, increase in the workforce development coming up, but then also an increase in unique partners, maybe that we did not have before. So, and I think you'll talk a little bit more about that. Okay. All right. So, as we continue to talk about strategies in workforce, the coalition is restructuring to more focus on supporting employers. Again, I mentioned that we had several employers who got these wonderful people that they were able to hire, but just didn't know how to utilize them, didn't know what to do with them. And so we are going to be focused on being a better support to those employers of community health workers. And then also providing that individual support that community health workers need. I enjoy every time we get to come together at the symposium, because those are opportunities that we get to see our fellow community health workers across the state and talk about how's it going. Tell me about all the wonderful things that your organization is doing, but then let's also talk about those challenges that you're still having and how can, as a coalition, can we support you in that. Also taking a look at policy and advocacy, sustainability payment models, again, that clarity and scope of work. And because we have such a diverse population that we serve, and Treva mentioned all of the different communities or populations that we serve, whether that's maternal health or focus on mental health, just making sure that we are providing the correct training and having clarity of that role in that workspace. And then also the mentorship piece. As a coalition, we plan to implement mentorship for community health workers. All the time occasionally I get to speak, occasionally I'll get to speak with community health workers who may be way out in western Kansas, and they're like, oh my gosh, another community health worker, I'm so glad that you're here, and being able to make that connection, but also making sure that they know that we're here and available, and we can help mentor them through those experiences that can be so challenging, and just letting them know that they are not alone, and we are here to support them, and also there to support their employers, and being able to also advocate with their employer if there is that struggle of, okay, I'm not sure that I'm doing the right thing, just doesn't seem right because I'm answering telephones from 8 to 5 and I never leave my desk. That just doesn't seem like a community health worker. So we can also, again, help provide advocacy support for a community health worker and making sure that the scope of work truly matches the role. Okay. Also, we're strengthening the community health worker roles within the health systems. making sure CHWs are visible, that they are valued, and this may sound crazy, that we have to do education in clinics or education in hospitals about community health workers, but it is true. I previously worked in a clinic and had to continuously provide education to our providers, again, about the role of community health workers. And then also ensuring the voice drives community health worker programs. And again, we love our allies. We love those folks who we get to partner with every day. But making sure the community health worker voice is elevated above every other voice for the work that we know so well. Also use community-based participatory approaches to design for community health worker initiatives. Anytime I get an invitation to be a part of a coalition or work that's being done and the word community health worker is mentioned in it, one of us should be at the table. There should be no way that there's discussion about community health workers or scope of work or funding without, talking to those folks who get in there and do it every day. So I really appreciate, again, those opportunities for partnerships and also elevating the voice of the community health worker. Okay. And then also as a coalition, we foster leadership and policy advocacy, and provide CHWs, again, with that training that they need to not only advocate for themselves on the local level, but also on state, and even opportunities to participate nationally in work for community health workers.
All right. So we told you the landscape and all the things, right, that we're doing and want to do and continue to do with you all as it relates to community health work. One of the things I want to mention as well, strategy, as it relates to strategies for continuing this work, is also we want to get out, we're talking to students, we want to get out and talk with medical school students and get those doctors and those nurses before they hit the floor, right? And educate them on what a CHW is, how a CHW can enhance your work and your practice. And I think those are ways that we can, we don't have to be at the clinic level saying, what is this again? If we can start there, right? And it just become a part of their curriculum, just hearing something about community health work and those types of things. So that's very important. But today we also just want to talk to you guys about some different ideas of spaces, of things that are going on in your areas. Our first question, are there some key initiatives or ideas that we've missed, like you didn't hear during this presentation? Nope. Nope, yeah, sorry. Anybody doing some exciting work? All right.
Where was the hand? Okay, I'm coming.
Get your steps.
Oh, Michelle, do you want to be the mic runner? She's quicker than me.
I am with the Kansas Pharmacists Association, and we
Nice.
have several initiatives going on right now where we are working on both dual training, so where we have existing pharmacy technicians training as community health workers, but we're also working on additional contracting and projects where we are looking to hire community health workers in community pharmacies to be able to provide community health worker specific services. So we have a lot of exciting opportunities right now where we're working in that space a lot.
That is fabulous, and that is a growing area, not just here, but also across the nation that failed to get in our slide deck. But thank you for that awesome work. Please reach out if you need anything, or we'd love to be a part. Anybody else have anything as it relates to that? What about have you any successful models that you've seen So I'll share a little bit about some things that are going on nationwide that are successful that I would like to see in Kansas, and some things that are going on in Kansas that haven't quite made it out to the world. So we are innovators, just so you know. We do have a very strong base, and we've been working in this space for quite some time. And so we are far advanced for quite a few states, some of our sister states, in that we have the coalition in the first place. We have certification. We have somewhat of a funding structure. So those are great initiatives that not all states have. Our work that we're doing with Justice Involved as far as training within the facility is new to Kansas. We were the first to start doing that, but already we have seen some duplications as we have presented to the Unity Conference in Nashua. There's some states that are like, oh, we can do that. So that's been great. A lot of other states, especially California, they work with their Justice Involved in a way that Kansas hasn't quite picked up yet, in that they have Justice Involved folks. They hadn't been training them, our residents, but they sent CHWs into the facilities. I would love to see more of that. We have a little bit of that going on down southeast in the jail space, but I would like to see more of that in our state prisons, and also having CHWs to work within the facility. Now, I haven't seen this one, but this is one that we're working on, is having CHWs from the facility, within the facility, working with other residents, right? So helping them to navigate a newly diagnosed chronic disease. There are programs around grief and palliative care where CHWs are able to get involved. And so those are, and SUD and peer stuff. So those are some awesome spaces. But any other spaces that just might be kooky enough to put a CHW that anybody can think of?
I kind of have a comment.
Okay.
So my other hat is I also sit on the board for the Immunize Kansas Coalition. In the last couple years, we did kind of a pilot project of sorts where we paired, I call them agnostic community health workers. So they don't work for a payer, they don't work for a healthcare organization. They worked for the Immunize Kansas Coalition and really advocated for immunizations and education. And we partnered with community pharmacies and really to improve vaccination rates in long-term care facilities. And what we found was when we sent community health workers that were specific to a cause and not tied to a payer or a healthcare organization to really engage residents about hesitations, fears, questions about immunizations, we were able to increase vaccination rates pretty dramatically just by pairing them with community health workers. And so I'm kind of thinking out loud. We've heard a lot today about community-based organizations, which is where you'd find some of those agnostic community health workers struggling to find funding mechanisms. They can't bill Medicaid, they can't bill Medicare. And then we're starting to hear about these concepts called community health hubs or care hubs, where an organization like an FQHC might designate themselves as a community care hub that can then bill for services of a network of CBOs. Are you seeing any traction or success with that in Kansas or anywhere else?
Yeah, so if you want to share too, I don't want to leave you out. But the biggest movement of that I've seen in Southeast Kansas, SEK, they have done an incredible job at that care hub model. They're in schools, in local jail, county jails, and those spaces with that care hub model. That is another space I really would like to see CHWs in as well, in other spots of the community. My brain's always clicking, around different things, but I feel like those care hubs could really be useful in some of our towns where we have correctional facilities, Winfield, like have the FQ close in that area, because where you go when you get out of jail, I mean, usually you're going to go to a FQ or some safety net or a free clinic or something, right? Because you don't have any money. So, but having CHWs trained and ready, right, to work with those folks and being able to pair them off like immediately on release. Those spaces would be great. Another one that came to my mind was libraries. That was one that was picking up traction in the Kansas City area, having CHWs in the libraries, working with a lot of our unhoused folks. Libraries seem to be a hub for that. And so that's a good space. I don't want to.
Yeah, you mentioned a lot of
expertise
the
here.
great ones. Yeah, and so the hub model, actually I had a discussion with that. I teach a community behavioral health worker course, and we're talking about, of course, the substance use and mental health. And she had mentioned that she felt it was really important that we create hubs centered around also mental health centers or behavioral health centers, again, because, folks can be so transient or that they have that place that they're familiar with that they can come to and receive services and not have to go one place in the town and go across the town to get to another place. And we're just not sure when we're going to see them again. And so being able to provide hubs that can meet several needs at once versus, okay, you're going to come here and then you're going to have to go somewhere else, or you're going to have to wait a few weeks before we can get you set up with applying for insurance, or before you can see a provider, all those different types of things. So I think the more accessible we can make these services, the better. So.
And those street teams, right? Those, they're just invaluable when you're talking about the unhoused populations who they can make an appointment and have every intention on getting there until, the police come through and clean out the camp. And then I don't know where I'm going to be sleeping and where I'm going to be doing tomorrow. And so, but if you can have a street team who brings, a team of folks out to those areas to be able to sign people up and see them where they are in the moment, those are also awesome spaces and places. You did mention the EMS model. So that's another space where CHWs have been working with some of the community paramedics. If any of you have heard of that, that's been an awesome model. We have so many I won't say specially, but it's our rural areas, it's amazing, right, that our rural areas and our urban areas actually have the same the same needs, just differently, if that makes sense. So transportation, access, all of those, the food insecurities are the same, but different. And EMS has also witnessed that in that people call because they don't have a way to the hospital, or because they fallen, or things that are not necessarily emergencies, but they're frequent callers because they don't have another avenue. Like, I don't know, I know 911. Like, that's the number I know, that's who I can call. And so CHWs have been working alongside of those folks when they find these frequent flyers, what they call, to help them get connected to services so that they don't have to make those calls as much, or so that an EMS can come out, the community paramedics, we can come out and they schedule, like, I'll be here once a month to take your blood pressure, or a week, or however long. Again, providing that service without that emergency bill and strain that it puts on our systems. And so just another place and space. Anyone else? How about some, there you go. I was like, come on now.
You already know I have the questions. Yeah, and with the CHW models, often wise, the models are already in place. So, for example, Mid-America Regional Council in Casey, they have a fantastic model of how to implement CHWs in a clinic. It's there, easy accessible for any sort of FQAC, public health, or any other community-based organizations. Often wise that I see is that it's not the CHW models, but the pre-existing conditions in the community that keep themselves siloed. And often wise, even if it's a CHW, a peer, case manager, there is this, I wouldn't say this hidden or unsaid biases that, oh, we should not refer them to them because we should be doing it. And why are you not doing it? And often wise, even I in the CHW who have worked in FQACs, the hospital system, in public health, often wise, we're told like, why are you not doing more? Well, I cannot do more because I'm not feel comfortable or equipped to do that. That's why I'm referring to my friend down there or my other colleague that I know can do this, and I know that they can get them set up quicker. How do you see that in terms through the coalition lens of advocacy for the CHW or for those roles that they often feel siloed?
Thank you for your question. And so I definitely feel where you're coming from. We worked with a hospital, and I had community health workers working, going into a hospital system where they hadn't been before, were as a partner coming in. And there was that question, okay, wait a minute, who are y'all and why do we need you? And not really having, again, that true understanding of what's your purpose? I'm the social worker and this is what I do. But really, again, providing that education about the role of the CHW, you know, designing and showing them, even though we have toolkits out there to show how to implement community health workers, sometimes it really takes that hands-on approach in having conversation after conversation so that they know and understand what it really truly could look like. And then also, again, reaffirming the scope of work for a community health worker. There are some things that I may not be qualified to do, therefore, one big part of our role is to refer. Make sure we're getting you connected to the expert in the field to be able to take care of your need. So if I'm a community health worker who I may have my certification, I've gone through the curriculum training and all of that, I'm not a behavioral health specialist. I don't have certain credentials that may be able to take care of something that is more higher level. Right, so I'm not going to be diagnosing, I'm not going to be giving out medications or advising on what medications you should take for your mental health condition. So again, I think it's a lot of education. And so one of the things, as I mentioned, was the coalition really taking a larger role in making connections with employers and stating, hey, can we get a meeting with you? We know that you have community health workers. Here's what we offer. Here's what we do. One of those things is tell us about your community health workers. You know, how do they practice? How do you utilize them? Do you see it as a true benefit? Are you seeing the increase in the data where you want to see it? Are you meeting the deliverables by utilizing your community health workers in the way that you're doing it? If not, you know, can we help you? Can we advise you on maybe some things you can do differently? And again, really truly being an advocate for the CHW. One of the things is for the coalition, board members are volunteers. Most of us have other positions, right? And then, of course, our members. They are members because they're in this coalition, in the community health worker space. So it's really going to take some dedication on our part as those volunteers for the coalition to say, okay, here's what the framework will look like. And so we're actually working on that. And then we're going to need support from employers to also be a part of this work and being engaged in allowing their community health workers to come to our meetings even our allies of the employers come into these meetings as well, so that we can all be in the same room, the same space, having conversations. And I think, again, it's going to take a lot of work, but it's going to have to be dedication and a willingness to show up, to be able to put this together. And so I invite anybody in this room who has and, is truly interested in supporting the workforce to join us in the coalition. You can always attend a board meeting. We always want to be able to hear from you who do the work every day. And so that we can make sure that we are providing what you truly need. So, but it's going to take time and it's going to take work. And I know it's necessary because we have so many community health workers, again, who feel like they're not really sure they're making the impact that they should be doing, or they're getting questioned about the work they are doing. And then also, can you do this, that, and the third? And feeling so overwhelmed. And so, did that kind of answer? Okay, so yeah, join us.
One of the other things I also just wanted to mention, in Kansas City Regional Collaborative, so it was the start, for those who don't know, it was kind of the start of the community health worker movement in our region, right? So we started with that Kansas City region, and then our state coalitions were built out of that. But one of the things that the states have not picked up on Kansas side is the collaborative piece for our payers and our advocates. And I think one of the things that once we get funding and structure, is having a space for our businesses and to collaborate as well. And even if we did it once a year or a breakout during the symposium, that would be a good space for us to kind of talk about, okay, what do you need? What have you seen? You can educate them a little bit more, what this looks like, what's working over here, and everybody can kind of talk and collaborate that way. So that was just an added.
And one thing I will add to that, I know we're coming down to the last step, but is, and again, we appreciate our supporters, and we continue to receive support, and our hopes and dreams, and I believe it's going to be reality, is that not only do we just have volunteers for this coalition, but having hired people who this is their focus, this is the work that they do. They're not having to come for an hour meeting or may have to miss the meeting because they have other work to do, but truly people who are dedicated just to the coalition for community health workers, and making sure truly the needs are being met and that it's consistent.
Yeah.
It's coming.
It's coming. Also want to invite anyone and all of you to also look at our National Association for Community Health Workers. I am there, obviously, sharing all the wonderful things that are going on here in the middle. That's what I tell them. In the middle. There's some good stuff in the middle. Because so much, our ends, East Coast, West Coast stuff. But we have a lot of good stuff going on in the middle. And so there's space. There are committees there as well that we can join. Again, being a voice for not only what's going on here, but also learning from what our, counterparts have done and are doing that we can implement and share back here at home. And so if that's something that you're interested in, the membership is very reasonable. It's only $20 a year. You can be involved, like I said, in the different committees and newsletters and all the toolkits that are being done on those spaces as well. We got a good time. We got 7 minutes.
Well, thank you all. If you will be here just a few minutes after this presentation, if you would like more information or want to connect with us or share your information with us, we would be happy to contact you.
I think we have another slide. There's our contact info. Thank you.